Hi, everybody. It was very wonderful, short kayaking vacation, but I'm happy to be back. Um, I always feel a little energy down coming back from nature into our crazy world. When you're in the nature elements, things feel a little different, at least for me. They feel real. They feel um, paced and peaceful. So. All right, so COVID, new variant. It sounds like this new variants are popping up. It's not a good sign. Whenever we see a new variant, it typically means virus continues to mutate and can basically expect at least potentially some of the flares. So the name of I have to pull it up because I already forgot. The name of the new strain, but I was looking at this a couple hours ago and now I can't find it easily. It's called Stratus, Stratus. It's actually not new. I already mentioned it. The original name for it, or the kind of a more pandemic or the formal name is XFG. It's a mix of two prior subvariants of Omicron, but it's an actually, they design it, they labeling it as a completely new strain, so Stratus, and it's supposed to, they don't know whether or not it's going to be worse in terms of um, spread. Now, it's clinically seems to be about the same severity as the last ones. It's not 100% clear as to what the response to the current vaccine would be with this one. It's pretty obvious that the new updated vaccine most likely will not include this one just because they can't keep up, right? They already been formulating one to include the strain that starts surfacing earlier in the summer, but by now we are now in a beginning of August. It's probably too late. It's also not really clear what will happen with vaccines. You probably have heard that government just shut down pretty much almost all mRNA vaccine research and formulation. The organization that was supposed to sponsor all of the mRNA pandemic vaccines. So that includes the COVID vaccine and possibly even the bird flu vaccine that they were trying to develop. That's all shut down. So they just removed all the grants. So that is not in coming. So basically, unless industry comes up with this on their own and get approved, it's hard to say what's going to happen. But obviously something will happen simply that we will have to have a boosters as we coming up for a continuous surge. Now the big surges are in California and the rest of the West Coast. Not exactly clear why. They're thinking maybe because it's pretty hot, so there tend to be more indoors in a air conditioned air. It's about the same here, in our area. What will happen further in the fall, we'll see. But again, of course, there is an expectation that as the schools restart, that we're going to see a flare. So that's number one. Now, I do want to talk about one specific topic within some of the new recent studies, and it is a global, pretty dramatic brain aging for entire population of the world. Basically, within the pandemic, the brain aging nearly tripled compared to before, and it's not even in patients who did not get COVID. So just the stress of the pandemic alone led to pretty dramatic worsening of condition in the whole world, in the entire population. It's not a surprise. We do know that the stress and particularly surges in cortisol level are very detrimental to the brain. And of course, we also know that patients who have gotten COVID, particularly patients who have been having hard time with the long COVID that has cognitive component, many of these patients present completely undistinguishable with a full-blown Alzheimer's disease. I have seen by now several dozen of such patients who basically, they present exactly like indistinguishable from Alzheimer's disease. Everything fits. The brain loss on MRI fits. The memory center hippocampus is most significantly affected. The difference is that when we run the biomarkers for Alzheimer's disease, these patients are negative. So they don't have an Alzheimer's disease because there's no plaque, but the brain loss and the function of the brain loss is pretty substantial. Now, will we see less impact with the future infections as we get more and more adapted to the virus? It's probably true. It's probably yes. But and yeah, I don't know if I can find the link. I'm sorry, I lost my search prior to the one when I was preparing for today. If I find but maybe somebody can Google this. This was in today's news in terms of the aging, brain aging. I think I don't remember what media it was in. All right, Lynette, I see your question, but let me just, I have a couple more quick things to present, and then we can, and then we can turn to Q&A. So, yeah, and so there's a big question now whether the insurances will cover the cost of vaccines, and I'm not kidding. There's a very good chance that the government will refuse the coverage. If that happens, they probably gonna jack up the price to several $100s per shot. That's my expectation. So if that happens, be prepared that at least if you have a private insurance, I think the Medicare most likely will cover it. I would be shocked if the Medicare, Medicaid will refuse to cover that. But private insurances may choose to do so, especially in this political climate. It wouldn't be surprising, especially if the approval for the boosters will be narrow. Right now they're discussing that there's going to be lots of population that will not qualify for automatic vaccine. That would include young people with no pre-existing medical conditions, and so it's feasible to presume that some of the private insurance is going to simply say, if it's not approved for you, we're not covering it for you. So I want to make sure that everybody's clear on that. Now, there's also a point of, okay, so now that the uptick is back again, what should you stock up at home? It's a good question, right? I think everybody at minimum should have the following at home. You need to have, and I would four things. That's what I'm suggesting. Have some zinc and vitamin C. Could be together or separate. You want to have zinc at 30 milligrams per capsule, and vitamin C 500 is fine. If you do get sick, take C with every meal, one or two capsules or tablets, so 500 to 1,000 milligram 2 or 3 times a day. Zinc, if it's 30, you can take twice a day, so again, one twice daily. Then I also recommend NAC. The actual term is N-Acetyl Cysteine. I'm going to put that in the chat so that you guys don't need to search N-Acetyl. Okay, I hope I'm spelling this right. If not, apologies, but NAC is the term. And the typical dose, you can get 600 or 900 milligram capsules and take one twice daily. Neck is slightly drying, so if you're on a dry side to begin with, I'd get a lower dose. I'd get 600. If you're actually on the other side, like me, who always, the moment you get any upper respiratory, anything, I'm all congested. If you're more on that side, then take a higher dose. Take 900. It's quite benign. It's an amino acid. You're not risking anything. Perfect. Oh, Janet, look at that. Okay, and then the last thing is this product called Natural D-Hist. It's okay that we are live and recording. It's fine that I'm giving specific product. There's no CMEs to today's presentation. It's by Orthomolecular brand.
Yes.
And the product is very good because it's a mix of several herbs. There is not enough NAC in there. There's only, I think, 500 or 100, 550 or 100 milligram per capsule. But there is quercetin and then several other molecules, bromelain and stinging nettle. And those are very, very good when you have a lot of acute inflammatory symptoms up here. Say, for example, not necessarily your sinuses, but any kind of congestion overall. This would be really good for. especially if you're prone to allergies like I am. So if COVID triggers almost like a hay fever together with the COVID symptoms, then this is going to be a great product. This is a very good product if you don't want to take antihistamine products. And there's been some concern taking antihistamines with acute COVID, thinking that it actually may somewhat delay the illness. I don't know if that research has been truly standing, but at some point I saw that document. Regardless, this product is natural. It's way better than taking antihistamine pills because, in contrast to antihistamines, it actually works quite differently. It simply scavenges out excessive histamine, and that allows you to regulate the immune response a lot better, because one of the big concerns why we have so much symptoms, especially if your immune system is robust, it's actually because there's just too much histamine floating around as a response to the viral infection.
Misha, was that cascade thing that everybody used to talk about at the beginning?
Pretty much. Like, well, it's more like well, you can call it a cascade or triggering event, that you have mast cells that are getting activated and they're releasing too much histamine. This also is a must-have product if you have a lot of allergies. If you haven't tried it, you definitely want to get this. It's not the cheapest product, but if you're my patient, shoot me an email. I'll set you up with a discount to make sure it's a little bit easier for you. Okay, we're going to what time do you want me to go to, Janet?
I don't
25?
know. Is Edward here?
I haven't seen him.
I haven't seen him either.
Well, I
So
guess then that leaves you guys with two of us, with Janet recovering after COVID, so we're not gonna ask you to talk much.
no, no, I'll reach out to Edward again because we talked earlier this week, so I know he knows he's supposed to be doing this. I just don't know what's going on.
All right. Well, maybe he'll show up at 2:30. So okay, let's do Q&A and then we'll see what happens. Okay. And by the way, of course, the reminder, if you're my patient, you have a more private question, more medical related question, please stay after 3 o'clock. We will end recording and we will discuss your needs separately. Okay, so can I see the hands raised? So I'll come back to you guys. Let me do a couple of questions in the chat first so that we start there, because there's a lot of questions in the chart. Okay, so the lithium for Alzheimer's is very outdated. I've been prescribing lithium for Alzheimer's for at least 10 years. So this data is not just not new, it's really, really old. There's a strong data that countries with a higher amount of lithium in the water has dramatically lower amount of Alzheimer's. Small trials of lithium for Alzheimer's have been successful. I've been using it in treatment for Alzheimer's for at least 15 years now. Almost all of my patients are either on some form of lithium, or at some point I checked their level and the lithium level was high. So if the level is high normal, I don't necessarily give lithium. But we are now also talking about brand new form of lithium, which is coming from Europe. It's called lithium ascorbate, which is at least 5 times more biologically active than orothate. Orothate is not the most absorbable form, so stay tuned. There's a lot. I'm actually been involved in some of the lithium research for quite some time, but my thoughts are it's the must element. It's not like it's one of those things you don't have enough of it in the water, you will have much higher risk of Alzheimer's, because lithium is critical for some of the neuroregenerative potential of the brain and decreasing amount of plaque. So that's pretty obvious. So all right, I'm sorry I don't have that link, Stephanie. Maybe you can find it. I can't do both at the same time. I can't answer questions and search for the link at the same time.
I'll drop it in.
But we'll come back. Yeah, the lithium, at some point, I think I probably should make a video about the lithium, since it's sort of been on my to-do list. So, um, but yeah, I'll if you not subscribe to our YouTube channel, go ahead and do so. I'll put the link so you don't miss things like this. All right. Let's go to the chat and then I'll go back. I think we're ended at Cecile's question. So I'll come back to that. All right. Lynette, let me ask you to unmute. Go ahead.
Hi, thank you. I
Sure.
have I have two questions. It was surprising to hear you say about the brain aging worldwide, uh, during the pandemic and the COVID time. And my question is, if a person has had COVID 2 or maybe 3 times, and maybe kind of now like presenting with some early dementia signs, do
Hmm.
you think that it's because of this brain aging and they're like 62? Do you think?
It's very, very possible. I mean, obviously the problem is you never really know what component of contribution of COVID would be. I mean, it's possible that this person would have ended up with dementia at some point anyway. But that's part of the problem. It's on an individual basis, it's going to be very difficult to evaluate a particular component. In order to do so, probably would need to have a full memory consultation. And just to put the shameless plug for our own program, GW, its memory clinic is run by, me and my colleagues, Dr. Prather, Dr. Al-Chalabi. So I think we have a good job that we do with this assessments, and so it is a bit of a wait list there because every insurance is accepted, but you can still get in. And if you want to refer this person, Lynette, by all means, you can do a full
Okay. All right. And my second question, you said that with this new variant being out now, that the old vaccine probably won't even help it, even if we could get it. Do you think that, because I keep getting notice from Safeway telling me to come and get my
Yeah, yeah.
update.
So the reason I'm telling everybody not to get it, especially if you had it last season, because it's the same exact vaccine you had last season. They haven't
Yes.
updated it. The new one hasn't been released. So you're gonna get a shot that's basically gonna offer you very little additional protection on top of what happened. Even though I said the outdated vaccine is probably not necessarily protecting against this new variant, it's not actually completely true. It doesn't protect well against getting the virus, getting some symptoms. It still protects you against severe illness. I mean, we have multiple studies saying that any course of vaccines has pretty substantial length of protection against, being hospitalized or dying from it. So, you still have some partial protection. I just don't see a real reason for most people to go and get that additional same vaccine at that 6 months mark that CDC recommends it, with exception that if you have a very weak immune system that changes things, then you should really talk to a doctor. But even if you just say over 65, if that's the only risk you have, I wouldn't, would not put you in that really high risk category if you had the last booster last fall. So, is that good?
Oh, yeah, that's very good. That's very good. And given the fact that in the future they may not even be developing anymore for any of the variants,
So,
maybe.
yeah, I think your guess is as good as mine. I do think they will be developing them because I think it's just going to be too much pressure on them. I just don't know what will happen with the coverage. I think they will try to privatize it as much as possible, so they will simply have the, market dictate the cost and demand and all that.
Mhm.
I'm not gonna comment on this because part of me thinks to myself that it's not such a horrible idea to really ration these vaccines carefully, to make sure we have always enough supply for more vulnerable population, and less vulnerable probably doesn't even need them. That is not, that's sort of, I'm in line with that thought process. So I'm in some way in line with the rationale of not giving the shot to the entire population anymore, and
Okay.
really thinking through carefully who should be getting it. And and then within that scope do have a coverage based on vulnerability. So if you medically justifiably gonna get the shot, then it should be covered. That's the way I take this. So, yeah.
Okay, great. Thank you very much.
Salome. Dear, you gotta unmute first. Can't hear you.
Names,
Nope.
yes.
There we go.
Another simple question. The COVID protocol, do you take it if you feel like you are catching something?
Pretty much. And if you really like, you can always take it for a couple of days, even if it's not COVID. You're not going to be at any risk from any of this, you know. Now, this is a simplified protocol. It doesn't include some parts, right? So there's a lot more stuff in the past that we discussed. We discussed higher dose of vitamin D. We discussed some other things. This is what I just think that you should have at home and all the time, especially
Okay.
towards the fall when it's flu, when it's common colds, when it's COVID, so that you have that stash. You know, otherwise what happens is we have this joke, right? All the problems always happens on Friday night when you can't get hold of anything and anywhere. And, you know, even buying stuff is not going to be necessarily easy if you're buying things from Fullscript. They're going to take a few extra days for shipment. So, you know, just think of it this way. Like we usually have stuff at home. Like I keep a keep an eye on our own stash. And so then when it gets low, I replace things, you know, and we always have. And, you know, the other things you can also, if you don't like taking capsules and you want to have mixed things, frankly, even things like emergency wouldn't be all that bad because emergency is a powder. It has some zinc. It has 1,000 milligrams of vitamin C. You can always get that from pretty much anywhere. So some of these things you can combine. So if you, and you can also get them in powdered form. It's if you really don't want to take all these capsules. So, but the
Okay.
D-Hist is a specific product. You do need that one. So sounds like you're coming down with something. Hopefully it's not COVID.
No, just I don't know. It's okay. When I was at the orthopedics doctor's office yesterday at GW, they asked me if I had been in contact with anybody who had COVID for the last 6 days. So
Oh,
it must
interesting.
be,
So
yeah,
yeah, so we've got, I think I saw that memo coming through that there are in some of the MFA clinics, they're now starting to pre-screen.
yeah,
And I see increasingly within, you know, so I'm on in clinic on Monday, Tuesday, and then I'm sharing space with infectious disease doctors. And I see more and more of them wearing masks. So I think it's a sign that they're seeing more patients who have infectious diseases. So yeah.
I'm wearing my mask,
Okay,
period.
good. All right, let me, Rona, I see your hand. Let me go back to a chat for a second and then do some questions. So Cecilia is asking about NAC and NAD are anti-aging and a complementary, both should be taking. All right, so Cecilia is always asking great questions. So yeah, so it's a very complex answer to this. NAD is definitely an anti-aging molecule. It's your own energy fuel. So NAD is a number one electron transport molecule. We have two molecules mostly, NAD and FAD. FAD is not available easily for commercial, like just to purchase to take extra, but NAD is. And all of that precursors to NAD, those of you who've been following longevity hype, quite well aware of these two molecules called NR, nicotinamide riboside, and NMN, nicotinamide mononucleotide. So those two things have been taught by people like David Sinclair and many others as this ultimate fountain of youth because of their NAD booster. I will tell you, most likely it's all scam. All of these products containing these nutrients, yes, you can increase the level of them in the blood, but it's very unclear what happens inside the cell, how these molecules as a precursor actually increase NAD. There's no concrete studies to prove that they indeed work in humans on a practical level versus taking NAD shots seems to be quite effective. So we've talked about this before. I will give you a link to my NAD video on YouTube. We are prescribing a lot of our patients at CIM NAD injections. You cannot take NAD orally. It doesn't do anything. It's not going to reach brain or it's not going to reach actually, most of your organs. It's just going to kind of get stuck in the liver. So let me give you the, let me put this down in there. This is actually, believe it or not, my most watched video on YouTube, so I'm kind of proud of that a little bit. And put that in a chat. All right, it's up to 30,000 views actually. So yeah, so 600 milligram, it's probably NAC, not NAD. Rhoda, I think you're thinking of NAC and NAD are completely different molecules. NAD comes in typically much lower doses, something like 50 milligrams. So they're different. So NAC is an antioxidant. It's a precursor to glutathione. NAC we eat with every meal that has protein. NAC is very high in dairy, particularly in whey protein. This is believed to be one of the most important reasons why whey protein is anti-inflammatory, is because, at least in part, to the NAC content. But you also can get NAC in capsules or tablets or whatever the form. NAC is highly absorbable. It will slowly raise glutathione. It's a lot cheaper than taking glutathione. Glutathione is also quite unstable and has a short shelf life, and AC has a very long half-life and a great molecule to take if you have any history of chronic inflammation. There is a little bit of a concern. You have to be careful taking NAC indefinitely. There is the same theoretical concern with NAD. There is a belief that both molecules can sort of protect cancer from your own immune system. So once the cancer develops, there's a theoretical fear that these molecules may actually make cancer grow faster. No one truly knows. We definitely do not give patients with active cancer treatment NAC because it will deactivate some of the chemotherapeutic agents. But this is getting too sophisticated, and if you're otherwise healthy, I don't think that this risk is real. I think it's a much more of a theoretical risk. So it's a really good question. Cecile, I don't know if you have any more questions to follow on that, but I'll go to the next one, okay? If you have more, let me know. So COVID tests are still widely available in supermarkets and pharmacies, easy to get. They now have the tests that can test you at the same time for flu and other things. So just if you're running low, I would suggest you always have a kit in a home, but you can also go to the pharmacy now that they're universally present. They are priced at around, probably, I don't know, you guys probably know better than me, somewhere between $15 to $20 a kit. So it's not free, it's not cheap, but hopefully it's not going to happen a lot to you. So, and I would only get tested if the suspicion is high. Like if you're having a common cold symptoms, don't test. I mean, it's very unlikely to be COVID, or if it is a COVID and it's very, very mild, you may just want to isolate yourself for a few days, regardless of what you have, right? So common sense. Okay, do we have enough lithium in our local water, if you know? Great question. No, we don't. US has lower levels of lithium. There are some parts of US that have higher. If you're on a well water, you may be way better off. Some of the well water in US is very high in lithium, and there are some pockets of high lithium in East Coast and also throughout the rest of the country, but there's no easy way of knowing. So, actually, I quite regularly test some of my patients. If I have a concern that patient is at risk, they have some psychiatric symptoms, they have memory problems, I sometimes will just check the level. Also, it's completely reasonable just to try to take it. Now, the problem is you will need to take it for quite some time. Only lithium ascorbate I have ever seen people report improvement in a very short period of time. Most people who take orotate will have to take it for quite a while. I mean, we're talking at least few months before you can sort of make some kind of a judgment. And the typical dose is 5 to 10 milligrams. So actually, thanks, Nancy, for the links, because clearly there's enough interest. So I am going to review the study and present this on the probably before the next Friday, so that everybody can take a look. How do you know if you have a weak immune system? Well, if you have common colds regularly, frequently, that's one reason. If you had a history of any herpetic infections, like a cold sores or shingles, they start flaring up. Like if you start having frequent attacks, that's a really good sign. Beyond that, you will need to run some tests. You'll need to run some basic tests like CBC to see what your white count is doing. Other than that, there's not the tests for screening of immune system are not common. They're not routine. If you go to your doctor and say, how is my immune system? They're probably just going to ask you some questions, exactly the ones I just told you. And if it's fine, then it's fine. Also, how quickly you heal. So after, let's say you have a cut, how quickly do you heal the cut, right? If you heal very quickly, that's a good sign. So I went to kayaking, and by the end of kayaking, it's even though actually this year it's better because I was wearing gloves a lot more. But usually my fingers are like just multiple scratches everywhere. It takes about 10 days. Now it's been only about a week, actually even less, and I don't even see anything. So like this year, it looks like my immune system is somewhat better than the last, at least in case of taking care of small wounds. Okay. Exactly. So all the supplements we talk about good for all respiratory illnesses. And I can't think of any interactions with anything you may be taking. So I think it's pretty safe. Except again, I mentioned if you have a cancer and you're taking some kind of chemotherapy, you probably should not take NAD and NAC. You need to be careful with that.
So just a
Just give
quick
a quick.
interruption.
Yeah.
Edward is here.
Okay. So I'm sorry, guys. Then there's still a lot of questions, but we definitely want Edward to have his time. So here's what I propose to everybody. If I didn't answer something, please hold your question because I think I'm gonna not be able to talk at the end of it. If you're my patient, and remember, if you need to ask me something specific, stay after. Otherwise, hold your questions, bring them in next Friday. We'll see what we can, and I will definitely, as I promised, going to review the lithium for Alzheimer's new old reminder, as I say it. Okay, Edward, thanks so much for being here. Let's highlight you for the view for everybody. Let's see where you are here. Okay, there you are.
Good afternoon.
All
Can you
right,
guys hear me well?
there you are. Oh, you're in a car. Oh my goodness. Okay. Good.
How is everyone? No, I'm not driving, by the way. I'm parked. So
Great.
just to put your mind at ease. It's been quite an afternoon. How's everyone doing?
Good.
Okay, so I'll get started. So I'm doing exactly what I wanted to talk to everyone about is breath. Did we get time to breathe today? Yes, we breathe, but do we consciously breathe? Take time to consciously breathe. Take your time to settle down, relax, and gather your thoughts. There's a lot going on health-wise, economic-wise, political-wise, and we're all getting pulled in all different directions. And sometimes we just have to find that me time, our time, to focus on the most important movement of all, because I always talk about movement for health, health in movement. If you don't move, you're not going to be healthy. To be healthy, you have to move. So we have to focus on the first thing we ever did in movement, which was breath. Why is breath important? It helps us settle down. It helps us gather focus. It helps sync the body, especially in movement. So when last did we sit down and take a deep breath? Inhale and exhale. When was the last time we did that? We're so pulled, we're so occupied. And I always want to say, slow down and smell the roses, right? Movement is important. Breath synced with movement. Some people call it energy work, right? So we should always find time, especially when you start your day, sit back, relax, take a deep breath. Inhale, exhale. Why is that important? So you find all your tension points in the body. There's a lot of tension points, and we'll never discover them if we don't stop and pause, right? We hold a lot of tension in the neck, we hold a lot of tension in the lower back and other places in the body. And when you discover these places, you start having a deeper feel of where there's discomfort, because usually when there's too much tension brings about discomfort, and then the discomfort becomes pain and all that. So a preemptive strike to avoid or to push that back is breath. stillness. We sit back, relax, whether you're drinking a cup of tea or coffee, whatever it is, or water, but you find that moment where you make it your me time. Anywhere from 2 minutes, you can start with 2 minutes, up to 5 minutes, maybe 10, 15, 20. The longer it gets, then it becomes a meditative thing, which is what it is really. But it's the process that we're focusing on, not the end result. Because if you do the steps right, you get the end result you want anyway, right? So the first movement is breath. So we'll take a deep breath, inhale, exhale. And once we've done that, once we found the stillness, then we move. Anywhere from just walking around, going for strolls. Movement helps to release tension points, right? So we do certain things, or we move real fast and we hold tension and we don't let go right away. And sometimes because we're preoccupied with other things, other thoughts or chores, do we have time to just find out where that tension point is and release and let go? And the question is letting go. How do we use the breath to teach us how to let go? Easy. When you inhale, you focus on the exhale, you feel the release where the lungs empty out, and you notice the body releases and calms down. So you inhale, take a deep breath, you feel the lungs, two feels, F-E-E-L and F-I-L-L, right? And you exhale and you feel the body releases. And you use your train of thought or your imagination, or you visualize the discomfort or the release leaving the body, right? And that way you start finding out where the tension points are. Oh, I can release my neck or release this. I can relax down. I use my breath, inhale and exhale. You don't want to hold your breath too long and you pass out, or you don't want to breathe too fast, you hyperventilate. But you find that rhythm in your breathing process, right? Everyone, based on your cardio level, right? You inhale, exhale, and you use the feeling of your lungs when they fill. And then when you exhale, you feel how the body releases and relaxes. And you hold on to that feeling and you put it around your body. So you feel your fingers, you feel your arms, the neck, every part of your body. Where you consciously put your mind, you can feel, right? So not moving, you're still, and you use the breath, the first movement that we know, to feel where the tension points are. And we use that to relax and release. Once we have that done or we have that going, then we get into movement. Movement starts from stillness. You always a point of rest before you move, right? So we use that to let go, release tension, the feeling of the exhale, the release. Then we train our minds, we bring a awareness, a consciousness into how to release. And then when we release very well, it's called relaxation. We learn to relax. So we don't need a glass of wine or beer or any other thing to help us release and relax, right? We can do it ourselves mentally, the healthier way to do that, right? Movement could be considered exercise, but how do we view exercise? Right? How do we view exercise? Is it a chore? Is it work? If you think of it as that, then it becomes a negative thing and you don't really want to do it. But if it's a routine, or you know what the benefits are for a healthier you, a healthier me, or revived you, or recalibrated you or me, that's what the breath does. Because when you tense up and you have to calm down and release and refocus, recalibrate so you get going again, or build your focus, we always use the breath. And we take the breath for granted because we do it any day, every day without thinking about it. But conscious breathing is movement within the movement that we do, if that makes sense. Right? So if we don't breathe, we all know if we don't breathe and we move, and especially if you're jogging or you're walking briskly and you don't bring in the oxygen, you're going to pass out. We don't want that. We have to supply the muscles and the body with oxygen so we can keep on going. But controlled breathing can make you endure and build up your lung capacity, which we call cardio strength or endurance to keep on going. Um, Talking about going, are we going through the day? Are we growing through the day? And growing through the days, are you making yourself be aware? Are we reacting or are we uh being more preemptive in what we're doing? Are we taking action as far as movement, as far as being healthier? Yes, we all want to be well, we want to feel great. But are we taking the necessary steps to do so? Are we allowing ourselves to get tugged to the left or right on something else? Yes, we can help but do that. Trust me, I just went through that today with the flat tire and all that stuff. And I almost got yanked out with frustration and tension. And I just realized, which is what I said, oh, I got to practice what I talk about, practice what I preach. So I had to reel back, take a deep breath, and realize the same things I have no control over, but I can control my me, my being, right? Yes, there are other external forces that influence or affect my reactions or how I go about, but still I have to disconnect from those things. We have to disconnect from those things temporarily for us to recalibrate. And the best way to do that is to remember to breathe. When we go through a day, we forget to breathe. Sometimes if you check yourself, you realize you're holding your breath. And when you hold your breath, you build tension in the body, right? And sometimes too much tension in the body can affect your mood because when you're a little agitated, if you scale back and realize, oh, it's all in the mind, can I calm myself down? Can I release what I feel? Can I control my feeling? Easier said than done, I know. But if we reel back and say, huh, how do I calm myself down? What do you do to calm yourself down? You take a deep breath. So I implore you guys to remember to take a deep breath. Right? Inhale. Do it with me if you don't mind. See if I'm wrong, right? Take a deep breath, inhale, and exhale. See how the body relaxes? We want to be relaxed, as if you're floating down a lazy river with a nice glass of good stuff in your hand, whatever, just going through the day, right? So you take a deep breath, inhale, exhale, inhale, exhale, and it brings about that calm, right? We know how to do this, but we forget to do this. So I always want to tell people, remember to do this. And those of us who are into exercising and all that, sometimes exercise does not have to be aggressive. You can move slow. You can stretch slow. Lengthen your arms slowly with a deep breath. Hug the world. Exhale and bring the hands down. See how you feel. When you're standing in line or wherever you could be, in a queue, whatever, take a deep breath, stand on one leg and control your breathing. Or you stand on both legs, control your breathing, right? The first movement, the most important movement of all, breath. Don't forget to breathe. You breathe with a purpose to calm yourself down, to recalibrate, to sync the body, right? The fingers are connected to the toes, connected to the fingers to the top of the head, not compartmentalized, right? So when you look at yoga, some of you do yoga already, you look at Tai Chi or you look at Qigong, those three modalities help use breath to help coordinate the body, sync the body, and then it also, the whole process makes it a mind, body, spirit experience. The intention, the energy, and then the expression, the movement, right? In Tai Chi, it's Yi, Qi, Li, meaning Yi, mind, intent, Qi, the energy that manifests to make the muscles or the strength of the muscles express or do the work or execute the movement. So it's always those things, your intention, the energy within, and the movement. So the energy to connect with the energy, you focus more on the feeling. So when you feel, okay, I can feel my movement, that's one thing. But then you pay attention to your breath within the movement and your movement being influenced by your breath. When you inhale, you bring in. When you exhale, you push out, what have you. If you're lifting, they always, you see the weightlifters do that. They take a deep breath first, and then they exhale explosively to activate the or fire out the muscles, right? As we know, whatever you're lifting from something heavy to something light, you actually hold your breath, in which you're stretching your fascia to measure how much force you're going to use or apply to the muscles to execute the movement. So breath in the beginning, and in the end, it's usually breath, but no ending just yet because we still have a lot to do, a lot to accomplish, feel. So let's keep on breathing and breathe some more. I hope I make sense. I'm making sense here. I think that's all I have for you guys today. Unless anyone has any questions for me. Yes, no? Are we there?
I don't
Am I
see
still?
any questions yet. But I do have a question for you. Actually, Randall has a question and Lynette has a question, so it's more important that they ask it. So I think Lynette was first. Lynette, do you want to unmute and ask?
I really don't have a question too much. And what I just want to say that I'm glad that you talked about breath a lot today, because breath is so important. And this morning I went out for a walk, and my left knee was kept feeling like it didn't want to cooperate with me. And I just kept walking anyway. And by the time I got back, whatever was happening in the beginning was gone. And I was breathing all through the whole thing. And I was doing this fast walk, slow walk. So, but I was breathing. I was constantly breathing. And when you talk about the breath today, I just sat here and I breathe in, breathe out, and I'm so calm. I feel like I've been through a meditation, actually. So thank you very much.
You're welcome.
Okay.
Thank you. Thank you.
And Randall, I think you had a question also.
Yes, thank you. Hi. That was a very helpful reminder. Two quick questions. The first quick one was, does it help to take a pause between the inhale and exhale? I know a lot of the things we practice meditation, sometimes you pause, but you were talking about just taking a breath and then taking a breath out. And my second question is, are there any practices you know of that would be helpful for, like, I have trouble, I'm too wound up in the evening, too wound up to get to sleep. Any practices that might help with, trying to like calm down and so I can get to sleep on time? Thank you.
Okay. There are two different philosophies in breathing. One I know based on yoga, where you hold the breath. When you inhale, you hold, and then you exhale, you hold. And the reason for doing that is to find the stillness within the breath. Right? That's one way to do it. In Tai Chi, the emphasis is on continuous breathing. You want to make the inhale and exhale very continuous without much of a break or pause in between. So it's almost based on the yin yang mindset or philosophy where the yin continuously feeds the yang as it continuously feeds the yin. So there's not a partial break. One of the exercises I learned, if you can't sleep, you got to do toe raises, move your feet a lot, stand on your feet, do toe, or if you don't stand on your feet, move your feet, dorsiflex, plantar flex. So you pull your toes up, stretch your toes, do that as both feet as frequently as possible. Hopefully that will help you to go to sleep sooner, or you're gonna find out why you're not going to sleep when you want to go to sleep. Are you worried? If that's the case, then you have to do yourself some introspection on why you're worried, or if that's the case, or if it's not that, is it anxiety? You got to go to the root cause of that, figure out why that is, or how late you ate. Sometimes if you eat pretty late, then the body's up before it crashes. So you might want to do some self-analysis and see why that is. Because sometimes when you do breath work, you won't go to sleep because your body gets energized too. So depends. Everyone's different. Some people, when I do enough breathing exercises and Tai Chi and energetic work, it drains me out. But once I take my nap and I'm back, I'm revived. Other people get vibrant, ready to go before it kind of, kills off. So I hope that answers your questions.
Yes, thank you.
You're welcome.
If you can't do the 4-7-8 though, is there a modified way? I think I have trouble holding it to 7.
I've always been taught not to force anything. Always go at 80% because the body will get stronger. It will adapt. That's the thing about our bodies. Our bodies do adapt. So we always have that gung ho mindset to give 110%, which is not true. It's better to go 70% consistently, continuously, and then the body adapts and it gets used to that. And then you'll do a test where you find out where your 100% is and you start going at 70%. But within 2 weeks, your 70% is no longer 70%. Your body is adapted and you can do a little bit more, and then you'll have to find a new 70% to continue evolve, getting better. But if you can't do the long counts, make the counts shorter so you can manage that and do that consistently, and then you'll find out you can increase the counts.
Thank you.
You're welcome.
Also,
Well, thank you, everybody. We're right at the hour. Edward, thanks so much for being here and being our regular visitor.
Thanks for
Hopefully,
having me. Much appreciated.
hopefully next time we'll get a little bit of movement.
Yes,
Life
yes,
happens.
yes.
All good. So everybody stay well. Janet posted in the chat, so next week we will have our well-known Nancy Abomona, who hasn't been with us for quite some time, so it's exciting that she's back. And looks like Michelle Clausen, who is in GW in the midwifery program. So it will be wonderful next Friday. Otherwise, see you whenever. If you, my patients, stay here. I see that Janet's. Oh, actually, Janet, I'm going to stop recording, okay?
yeah.
And
Randall, I